Right now, I would like to our technical support team to have a little bit of discussion and talk to all previous speakers simultaneously because we already have some questions from the audience. So the question to Mikhail, to Professor Grymov. Whilst we're waiting for him, I'm asking question to Vera. So this is a very interesting study on autoimmune mechanisms carried out by your team. Is it possible to carry out immunological studies like particular marker of the efficacy of the glaucoma treatments? Well, thank you very much, Natalia, for your question. Well, this is a very interesting view, and we never carried it out, although if we monitor the level of antibodies I talked about, let's say neuron-specific analysis that demonstrates the level of homeostasis, metabolic homeostasis in the retinal ganglia cell. So with the treatment, it would be great to see how the recovery of homeostasis takes place. So that means antibody normalization would mean that the cell is normalized, and totally opposite, the reduction or disappearance could say that the cell falls to neurodegeneration and ready to go to the apoptosis, which is very interesting study, and definitely we would be happy to continue to proceed. So in principle, you believe that there is some perspective here, because let me remind you, colleagues, there are huge great studies carried out in Germany by Gussum. He is actually one of the main investigators of immunology in glaucoma, and every time they got quite contradictory data. So on the one hand, they found some specific changes in the immune system in glaucoma, but on the other hand, they found similar changes in the control group as well. So you still believe that we need to continue studies in this direction, and it sounds very perspective. Yes, yes, especially in the fact that different compartments differently react to the immune mechanisms, and it is not yet quite clear where the process of neurodegeneration starts from specifically. I think in this context, we need to check and examine and to carry out some correlation studies, benchmark studies, in order to understand how we can use this data. Well, definitely, but this is very complicated study. So there is another question from the audience. So today, maybe for the first time, we spoke in detail the aspects of neuroinflammation when we speak about the pathogenesis of glaucoma, optic and neuropathy. And I'm very grateful. So the doctors are asking, can we plan anti-inflammatory treatment in this case? So what do you think? As I said before, for the inflammation and neuroinflammation. So they are multifactorial, so they are multifaceted. So if we speak about neurodegeneration of the retina, we see lots of therapeutical options that are directly related with the suppression of the complement components. And there are first publications that confirm the efficacy of that. But if we examine the types of aspects of complement which are suffering in glaucoma, and they are in fact already identified. So these are classical components, 1Q, and then you can easily deal with the design of the therapeutic strategies focused on neuroprotective treatments as a suppression of inflammation, for example. Yes, yes. Sounds very prospective. So let me remind you that currently Vera spoke about the VMD treatment, which is also neurodegenerative pathology, and probably not all doctors understand that, but actually this is true, and we need to treat these patients. Colleagues, are we ready to ask Mikhail? Mikhail,
Да,
are
я
you with
вас
us?
слышу.
Yes, yes, I'm
Наталья
here.
Ивановна, слушаю.
So once again, thank you very much for your very fundamental presentation. So I have a question to ask here. There are lots of common things in pathogenesis of neurodegenerative diseases of CNS and glaucoma, which is obvious. Can we extrapolate this knowledge to a certain extent, neurological knowledge to glaucoma, and the most important, can we, in the perspective, use those treatments or the types of treatment that are about to use for the treatment of neurodegenerative pathology in glaucoma? So what do you think?
Вы знаете, мне кажется, это очень интересный
Well, I
вопрос,
think
на
that's
который
very interesting
я, как не
question,
специалист
but I'm
в
not
области
glaucoma
глаукомы, смогу, наверное,
specialist,
ответить. Значит,
but
первое,
I
это
will
что мне
try.
кажется, что,
Well, I
безусловно,
think that
сценарий
definitely
развития
the scenario of
любого нейродегенеративного заболевания
neurodegeneration development,
хронического,
actually
он
any
примерно
chronic
одинаков.
neurodegeneration,
Это первое.
should be very
Но,
similar.
тем не менее,
That's
есть
first. But
специфические
nevertheless,
направления,
there are
как
some
вот, например,
specific
изучение
directions,
глаукомы,
let's say,
изучение
to
болезни
study
Паркинсона, болезни
glaucoma or
Альцгеймера.
Parkinson
И там
disease
люди
or
занимаются уже
Alzheimer's
более
disease,
узкими
and the
вопросами и
colleagues are already
используя,
dealing with
в
more
принципе, одну и ту же
specialized issues
методологию.
using
Ну,
the
скажем,
same
прежде всего,
methodology.
разработку
Let's say,
ранней диагностики и
first, they
превентивного
try to
лечения.
design early
Но вот надо
diagnosis and
сказать,
preventive
что
treatment.
они как бы бегут на перегонки,
But let's
но
say they're
кто-то в
running
чем-то
ahead of each other,
бежит
but
быстрее,
actually
а кто-то
somebody is
отстает.
faster, but
И
somebody is
поэтому мне
behind the
кажется, что
leader.
вот такие
And I think
смежные знания
so. This neighboring
могут
areas
быть очень
knowledge, the
полезными,
neighboring therapeutic
если
areas could be
по
very
этим
useful,
смежным
extremely
знаниям
useful.
какое-то направление уходит
If,
вперед.
let's say,
Я, например, могу
one
сказать,
of the
что то, что я
therapeutic
сейчас
areas is making a
прослушал,
breakthrough.
на меня
So I was
произвело большое
listening with a
впечатление в
great
каком
interest,
отношении?
and it
В
actually
том
thrilled me
отношении, что
quite a
есть, по
lot,
крайней мере, для меня
because at last we
очевиден один
understand
аспект,
this is
в
very
котором
obvious
лечение
aspects
глаукомы
where the
значительно более
glaucoma
успешно
treatment is
сейчас
much more
разрабатывается, чем при
successful
той же
now
болезни Паркинсона или
versus
болезни
Parkinson
Альцгеймера.
or
Ну вот
Alzheimer,
о
for
чем идет
example.
речь? О том, что
So what do
понятно,
I
что в
mean by that? It
нейропротекции
is very clear that
важную роль должны играть ростовые или нейротрофические
growth or
факторы. Это
neurotrophic
уже
factors should
это
play a very
известно.
big role in the
Но что
degeneration and
получается,
inflammation,
что
and we know that very
вот при
well. But
лечении
at the end,
глаукомы
it happens that in glaucoma
клинические
treatment,
испытания
the
завершаются
clinical
успешно,
trials
и
are completed
FDA одобряет для
successfully, and
использования в
regulators,
клинике
including
этих
FDA,
ростовых факторов.
approves
А
these
вот
growth
все
factors
попытки,
to be used
насколько
in
я знаю, до
clinics.
сих
But
пор
all
в
the attempts,
проведении
as far as I
клинических
know,
испытаний,
all the attempts until
используя
now, carrying
ростовых
out
факторов для
trials and
лечения
using the
болезни
growth
Паркинсона и
factors for
болезни
the treatment of
Альцгеймера,
Parkinson's
они
disease,
заканчиваются
Alzheimer's disease,
неудачно.
they are
И
all a failure.
вот это, мне кажется,
And I
повод для
think
того, чтобы задуматься,
it is a
почему вот
reason
это
to
все
think it over.
происходит.
Why that
Безусловно,
happens? Well,
при
definitely,
глаукоме и вообще
definitely.
при
In
лечении
case of
глазных
glaucoma
болезней
and in case of
есть одно очень важное преимущество, что это фактически можно неинвазивно делать. А
these
при
diseases, you
других
can do it
нейродегенеративных
non-invasively, but in
заболеваниях нужно
other
делать
neurodegenerative
системно
diseases,
или
you need to
в
provide
крайнем
systemic
случае
effect, or
путем
at
адресной
least
доставки
it should be a
лекарственных
targeted
средств при
delivery of the
интраназальном
drug
введении.
in
Но
the
все равно это
intranasal
вариант системного
administration, but
введения.
still this is a
Поэтому я
systemic
еще раз
effect.
повторяю, что
So
мне
once
кажется,
again,
что
I'm
люди,
repeating
которые
it.
занимаются
It
конкретным
seems to me
направлением,
those who are
должны
dealing
очень
with the
серьезно
specific
отслеживать
therapeutic areas
успехи
should really
смежных
track and
направлений для того,
monitor
чтобы
the neighboring
использовать их для
specialties and
продвижения
then to
собственного
use this
направления. Это
knowledge for the
первое. И
promote
вот
of
для
their
меня,
own
например,
ideas.
я говорю
And to
сейчас
me,
очень
for
интересный
example, and
факт, это то, что
it's quite
в
an interesting
глаукоме
fact
гораздо
now that
больше
in
успехи
glaucoma
достигнуты
we have
при
much bigger success
использовании в
versus
качестве
Parkinson or
нейропротекторов ростовых
Alzheimer's,
факторов.
speaking
Спасибо.
about growth factors as neuroprotectors. Thank you very much, Mikhail. Thank you very much. Well, in fact, I disagree with you. I don't think we have great success here. Maybe it sounded like this from the previous presentation of Professor Spark, but we will comment that later on. Still, we face multiple challenges, but there is one frequent question, and now I'm asking you, a very high-level speakers here. So we used to believe that even if we find some neuroprotectors, they will be able to be used as a course-based courses treatment with glaucoma or with other pathologies. So how can you comment such course-based approach to treatment? Mikhail.
Вы понимаете, дело в том, что
The point is,
вообще процесс нейродегенерации – это
the process
непрерывный
of
процесс. И
neurodegeneration
поэтому,
is
по крайней мере,
continuous.
я буду говорить о том, что я
So at
продумал при
least I'm
болезни
saying that
Паркинсона.
we
И,
see that in Parkinson's disease,
наверное, в какой-то
and
степени это относится к другим заболеваниям,
to a
что
certain
лечение
extent it
нейропротекторами, оно должно
refers to
начинаться
the
на
other
ранней стадии,
treatments.
когда
I
нет
think
дефицита
neuroprotective treatment should
конкретного
be started at early stage, where
нейротрансмиттера,
there is no
который играет
deficiency
как
of
раз
one specific
ключевую роль в развитии
neurotransmitter that plays a
патологии,
critical
такого
role
как
in the
дофамин при
development of
болезни Паркинсона,
particular like
такого как
dopamine in Parkinson's
ацетилхолин при
disease or
болезни Альцгеймера
acetylcholine in
и так
Alzheimer's
далее.
disease.
Вот на ранней стадии
So at
дефицита
earlier
такого
stages,
нейротрансмиттера нет,
the
поэтому
deficiency
все
of such
должно
neurotransmitter is
упираться и
not seen,
основываться
so
на
everything should
нейропротекции.
be based on
Но
neuroprotection.
нейропротекция, и я
But
показывал, что для
neuroprotection,
этого
and
должен
actually
быть
I already
использован
showed it to
коктейль
you that for
веществ, и об
that we
этом
need to
дальше
use the
говорилось.
cocktail of
Это и
substances, and
противовоспалительные,
we speak about it.
антиапоптотические и
So
так
these are
далее, и так далее.
anti-inflammatory,
Ну вот
anti-apoptotic,
схема
etc.,
применения
etc.
этих
But the
веществ,
scheme of this
то,
using
что
these
вы говорили,
products to
это
me,
частный
so
случай,
that you mentioned,
схема
it's just a
применения,
particular
она
case.
должна
So, but
существенно зависеть,
it
видимо,
should
от
dramatically
стадии
depend
развития
on the
заболевания
stage
и
of
от
the
уровня
disease development
нейродегенерации.
and the
То есть что
level of
значит схема?
neurodegeneration. So what
Схема –
does it
это
mean, the
значит, что
scheme?
на каждом
So that
этапе
means at each
прогрессирующей
stage of the
регенерации
progressive
должно быть
degeneration,
определенное,
we should
должны использоваться
we should
лекарственные
use
средства нейропротектора в
particular
определенной
treatments or
дозе, в
neuroprotectors in a
определенном
specific dose,
сочетании,
in the
вот
specific
из тех
combination,
компонентов
well,
коктейля, о
from
которых
those
я говорил, и
components
с
or
определенной
cocktails I spoke
частотой.
about, and
Вот
with a
я думаю,
particular
до
rate.
сих пор
So I think
вот
until
эта
recently,
методология, она
such
до сих пор не
methodology
разработана
has
даже
not
на
yet been
моделях
designed,
экспериментальных.
even in
То,
the
что касается
experimental
болезни
models.
Паркинсона и болезни
Speaking
Альцгеймера, это я
about
точно
Parkinson
знаю.
or Alzheimer's
Вот.
disease, I
И
know
я
that for
думаю, что вот
sure.
сейчас как раз мы
And
приступили, мы
I think
разработали
now we
модели,
already
и
started
клинические, и
designing these models,
животные модели, и
clinical
клеточные
models
модели
and animal models
болезни
and cell
Паркинсона, и
models
мы
of
сейчас
Parkinson's
приступаем вот к
disease.
разработке такой схемы
And
применения нейропротекторов.
this is a scheme
И
of using
частным вопросом
neuroprotectors.
будет как раз
And
тот, о котором вы
one
говорите. Какие
particular
должны
issue would
быть
be the
курсы,
one we
могут ли
discussed
они быть
before. So
периодическими, с
what
какой
be
периодичностью,
the
как
causes
должна
and what
меняться,
should be the
должны меняться дозы и
duration
так далее.
and
Ну, это то, что я
how
уже
the
сказал.
dose should be
Вот мне кажется,
changed.
это более широкий вопрос, чем
I
тот,
think
который
this
вы
is much
задавали,
wider
и он
from what
требует очень
you
серьезной
asked
работы
before, and
дальнейшей.
it requires particular attention. Thank you very much. And now another question to Dr. Spak. According to your understanding, diagnostic value, and what could you say about it? So that's a separate question. And this is BDNF and CTNF. And I think there is a good correlation in between the content in the tear fluid and in the anterior compartment. So the tear fluid can be used, but please do not forget that this is quite challenging study. It should be quite a good design of that. And actually, highly qualified team was dealing with that, led by Professor Natalia Gulyayeva. She is a very famous specialist, as you know. And if this is properly organized, and by the way, each study, each test costs $10, so you need to have some support, and then you can deal with that, no doubt. But in case of NDF, the correlation is very weak. But in case of glial factor, there is no correlation at all. So that means there is no sense to measure it according to the TFL. So that's why we need to be based on the situation which is individual for each factor. And we need to have a very well-equipped laboratory to carry out all these tests. But in fact, this is another direction of studies with very big perspective. And also from your study, we clearly see that there is a change of growth factors, and it is increasing specifically for some of them with the progression of the disease. We also should keep it in mind. And according to the recent literature data, there is very high effect of neurotrophic factors when they are used in the form of cocktail, not just one ciliary growth factor like Neurotech is offering that. And by the way, This is just phase one of the clinical trials. It's not yet the final product. So this is not phase three yet. But if we just imagine that there is such treatment and there are great neurotrophic factors available for the treatment of the patients with neurodegeneration. So there is a question when we should start this treatment. What do you think, Alexander? Again, in my presentation, you clearly saw that some factors are increasing and some are reducing. So the ones that are increasing, the most important there is to start as early as possible, at earlier stages, and where they are reducing, so, but the effect could be even stronger. So thank you very much for very good answers and a very contentful presentation. Now we see how complicated this system is. But there is a clear vector in the studies. This is what we need to understand in order to move on and not in the treatment, but probably in the study and in the diagnosis. Well, I'm extremely grateful for your comments. Vera, do you have any questions? No, it sounds all crystal clear.